When I was 50, I started noticing some hair loss. It was starting to recede and my temples were getting really, really thin. This happened so slowly that, you kind of think, is this my imagination? I couldn't pull my hair back anymore and I needed to wear a hat. I told my husband, who liked long hair, I'm going to have to keep it short because it's too thin. It was embarrassing. I was looking in the mirror one day and I was pulling my hair back and I realized there was nothing there to pull up anymore on the sides. And so I'm like, this is getting serious. I tried shampoos and vitamins, stopped processing my hair, and nothing really worked. As a last resort, I made this appointment for this hair clinic and they pulled out this silver helmet thing and it was called an iGrow. And it was like, oh my gosh, it looks like an astronaut helmet. But you know what? If it works, I was willing to do it. So I was very faithful. I've even traveled with it. I was really hopeful that I would have my old hair back.
Joining us now are Leanne and cosmetic surgeon Dr. Darshan Shah. And proof's in the pudding, right?
Yes, sir.
Are we able to see in that area? Are you able to pull your hair back a little bit? Or
I don't know all the hairspray, but I've got all kinds of babies. I mean, it's just really thickening up.
And how long has the treatment been going on?
I started 18 months ago when I found the Hair Restoration Institute in DFW, and within 4 months, I noticed baby hairs with the microscope. And within 6 months, I could see baby hairs with my eye.
Dr. Shah.
Sure.
What is the technology behind iGrow?
So basically what it is, technology has been around for a while, but I think iGrow has really perfected it. It's a low-level laser therapy. It uses a specific wavelength of red light that is really close to your scalp, and that excites and invigorates the follicular cells. So once the cells get excited, they start growing thicker and longer.
How much is this?
I think it's working right now.
It's about $500.
Dr. Shah, who is the ideal candidate?
So for every candidate, you first want to make sure there's no hormonal causes, and you want to do a diagnostic workup. Once you do a diagnostic workup, most people end up just finding they have some genetic cause of hair loss. And in that case, you're a good candidate for the iGrow. Pretty much, I've used it on all kinds of patients, men and women, genetic hair loss. They all tend to benefit from it.
But you do need viable hair follicles, right?
Exactly. So if you're completely bald or you have a condition called alopecia where there's no hair in certain areas, this won't work.
And short of a device like this, there are other things that I think are helpful for men and women. More for women, I think, struggling with thinning hair and losing hair, which is try to rest your hair. Because all that styling, coloring, heat, that will literally pull hair out.
Right.
Traction alopecia is a big deal. You talked about this, Leanne. When you pull your hair back, you actually can be pulling hair follicles out. Biotin, you're a big believer in the vitamin B. Biotin, about 5,000 micrograms.
And just reducing stress, too. Stress is a big factor towards hair
overall
loss.
Health.
Exactly.
Just general health.
Watch what you eat and exercise.
What's cool is you have more and more tools in the arsenal.
Right.
Not only things you can do on your own, but treatments. And to me, hey, more treatments are always great, and clearly you're happy. And that's
you look great.